101. What is the most common cause of peptic ulcers? A. Bacterial infection, Helicobacter pylori. B. Excessive alcohol consumption. C. Stress. D. Smoking. Answer: A. Bacterial infection, Helicobacter pylori. Rationale: the most common cause of peptic ulcers is infection with Helicobacter pylori bacteria, while excessive alcohol, B, stress, C, and smoking, D, can contribute. They are not the primary causes. 102. Which of the following is a common symptom of a peptic ulcer? A. Abdominal pain. B. Fever. C. Diarrhea. D. Nausea and vomiting. Answer: A. Abdominal pain. Rationale: abdominal pain is the most common symptom of a peptic ulcer, typically described as a burning sensation. Fever, B, diarrhea, C, and nausea/vomiting, D, are less commonly associated with peptic ulcers. 103. What is the most common treatment for peptic ulcers caused by Helicobacter pylori infection? A. Antibiotics and proton pump inhibitors. B. Surgery. C. Antacids. D. H2 blockers. Answer: A. Antibiotics and proton pump inhibitors. Rationale: peptic ulcers caused by Helicobacter pylori are typically treated with a combination of antibiotics and proton pump inhibitors to eradicate the infection and promote healing. Surgery, B, is not the first-line treatment, and antacids, C, or H2 blockers, D, alone are less effective. 104. Which of the following is a common complication of peptic ulcers? A. Perforation. B. Stroke. C. Heart failure. D. Diabetic ketoacidosis. Answer: A. Perforation. Rationale: one of the most serious complications of peptic ulcers is perforation, where the ulcer creates a hole in the stomach or duodenal wall, leading to peritonitis. Stroke, B, heart failure, C, and diabetic ketoacidosis, D, are not common complications of peptic ulcers. 105. What is the main cause of irritable bowel syndrome, IBS? A. Inflammatory bowel disease. B. Infection with bacteria or parasites. C. Altered gut motility and sensitivity. D. Malabsorption of nutrients. Answer: C. Altered gut motility and sensitivity. Rationale: IBS is thought to be caused by altered motility and sensitivity of the gut, leading to symptoms like abdominal pain and changes in bowel habits. Inflammatory bowel disease, A, infection, B, and malabsorption, D, are not the primary causes of IBS. 106. Which of the following is a common symptom of irritable bowel syndrome, IBS? A. Abdominal pain and bloating. B. Weight loss. C. Blood in stools. D. Severe diarrhea. Answer: A. Abdominal pain and bloating. Rationale: IBS is commonly associated with abdominal pain, bloating, and changes in bowel movements, e.g., diarrhea or constipation. Weight loss, B, blood in stools, C, and severe diarrhea, D, are not typical of IBS. 107. What is the primary treatment for irritable bowel syndrome, IBS? A. Antibiotics. B. Anti-inflammatory medications. C. Dietary changes and medications to manage symptoms. D. Surgery. Answer: C. Dietary changes and medications to manage symptoms. Rationale: IBS is primarily managed with dietary changes, e.g., fiber intake, and medications to relieve symptoms, e.g., antispasmodics. Antibiotics, A, anti-inflammatory medications, B, and surgery, D, are not typical treatments for IBS. 108. What is the most common type of inflammatory bowel disease, IBD? A. Crohn's disease. B. Ulcerative colitis. C. Celiac disease. D. Diverticulitis. Answer: B. Ulcerative colitis. Rationale: ulcerative colitis is the most common type of IBD, characterized by inflammation of the colon. Crohn's disease, A, is another type of IBD but is less common. Celiac disease, C, is an autoimmune disorder, and diverticulitis, D, is a separate condition. 109. What is the primary symptom of ulcerative colitis? A. Abdominal pain and bloody diarrhea. B. Vomiting and weight loss. C. Abdominal bloating and constipation. D. Jaundice and fever. Answer: A. Abdominal pain and bloody diarrhea. Rationale: the primary symptoms of ulcerative colitis are abdominal pain and bloody diarrhea due to inflammation of the colon. Vomiting and weight loss, B. Bloating and constipation, C. And jaundice and fever, D. are not typically seen in ulcerative colitis. 110. What is the main goal of treatment for inflammatory bowel disease, IBD? A. Cure the disease. B. Control symptoms and induce remission. C. Prevent all flare-ups. D. Promote weight gain. Answer: B. Control symptoms and induce remission. Rationale: the main goal of IBD treatment is to control symptoms, reduce inflammation, and induce periods of remission. There is no cure for IBD, A, and flare-ups cannot always be prevented, C. Promoting weight gain, D, is not a primary goal. 111. What is the most common cause of appendicitis? A. Bacterial infection. B. Obstruction of the appendix. C. Viral infection. D. Trauma. Answer: B. Obstruction of the appendix. Rationale: appendicitis is most commonly caused by obstruction of the appendix, often due to fecal matter or a foreign body. Bacterial infection, A, can follow obstruction, but it is not the primary cause. Viral infection, C, and trauma, D, are less common causes. 112. Which of the following is a common symptom of appendicitis? A. Right lower abdominal pain. B. Chest pain. C. Severe headache. D. Pain in the lower back. Answer: A. Right lower abdominal pain. Rationale: appendicitis typically causes sharp pain in the right lower abdomen. Chest pain, B. Severe headache, C. And lower back pain, D. are not associated with appendicitis. 113. What is the primary treatment for appendicitis? A. Antibiotics. B. Surgery, appendectomy. C. Pain medications. D. Radiation therapy. Answer: B. Surgery, appendectomy. Rationale: the primary treatment for appendicitis is surgery to remove the appendix, appendectomy. Antibiotics, A, may be used preoperatively, but surgery is the definitive treatment. Pain medications, C, and radiation therapy, D, are not the main treatments. 114. What is the most common cause of diverticulosis? A. High-fiber diet. B. Low-fiber diet. C. Alcohol abuse. D. Sedentary lifestyle. Answer: B. Low-fiber diet. Rationale: diverticulosis is often caused by a low-fiber diet, which can lead to increased pressure in the colon and the formation of diverticula. High-fiber diets, A, alcohol abuse, C, and sedentary lifestyles, D, are not primary causes. 115. What is the most common symptom of diverticulitis? A. Left lower abdominal pain. B. Right lower abdominal pain. C. Nausea and vomiting. D. Diarrhea. Answer: A. Left lower abdominal pain. Rationale: diverticulitis often causes pain in the left lower abdomen due to inflammation of the diverticula. Right lower abdominal pain, B, is not typical, and nausea, vomiting, C, and diarrhea, D, are less common symptoms. 116. Which of the following is a common complication of diverticulitis? A. Abscess formation. B. Liver failure. C. Stroke. D. Hypertension. Answer: A. Abscess formation. Rationale: a common complication of diverticulitis is the formation of an abscess, which may require drainage. Liver failure, B, stroke, C, and hypertension, D, are not typical complications of diverticulitis. 117. What is the primary treatment for diverticulitis? A. Antibiotics and bowel rest. B. Surgery. C. Pain medications. D. Chemotherapy. Answer: A. Antibiotics and bowel rest. Rationale: diverticulitis is typically treated with antibiotics and bowel rest. Surgery, B, may be required for severe cases, but it is not the first-line treatment. Pain medications, C, and chemotherapy, D, are not commonly used for diverticulitis. 118. What is the most common cause of gallstones? A. Obesity. B. High-fat diet. C. Low-fiber diet. D. Excessive alcohol consumption. Answer: A. Obesity. Rationale: obesity is a major risk factor for gallstones due to increased cholesterol levels in the bile. High-fat diet, B, and low-fiber diet, C, also contribute, but obesity, A, is the primary cause. 119. Which of the following is a common symptom of gallstones? A. Jaundice. B. Chest pain. C. Abdominal pain in the right upper quadrant. D. Diarrhea. Answer: C. Abdominal pain in the right upper quadrant. Rationale: gallstones typically cause pain in the right upper abdomen, especially after eating fatty meals. Jaundice, A, chest pain, B, and diarrhea, D, are not common symptoms of gallstones. 120. What is the primary treatment for symptomatic gallstones? A. Surgery to remove the gallbladder, cholecystectomy. B. Antibiotics. C. Pain medications. D. Chemotherapy. Answer: A. Surgery to remove the gallbladder, cholecystectomy. Rationale: the primary treatment for symptomatic gallstones is surgery to remove the gallbladder, cholecystectomy. Antibiotics, B, pain medications, C, and chemotherapy, D, are not typically used for gallstones. 121. What is the primary function of the liver? A. Produce insulin. B. Metabolize toxins and produce bile. C. Store glucose. D. Produce red blood cells. Answer: B. Metabolize toxins and produce bile. Rationale: the liver's primary functions include metabolizing toxins, producing bile, and processing nutrients from food. Insulin production, A, occurs in the pancreas, glucose storage, C, happens in the liver but is a secondary function, and red blood cell production, D, takes place in the bone marrow. 122. Which of the following is a common sign of liver disease? A. Jaundice. B. Diarrhea. C. Constipation. D. Weight loss. Answer: A. Jaundice. Rationale: jaundice, characterized by yellowing of the skin and eyes, is a common sign of liver disease due to the accumulation of bilirubin. Diarrhea, B, constipation, C, and weight loss, D, may be associated with various conditions but are not specific signs of liver disease. 123. What is the most common cause of cirrhosis? A. Alcohol abuse. B. Viral hepatitis. C. Obesity. D. Autoimmune diseases. Answer: A. Alcohol abuse. Rationale: alcohol abuse is the most common cause of cirrhosis, followed by viral hepatitis, B. Obesity, C, can lead to fatty liver disease, but is not as common a cause of cirrhosis, and autoimmune diseases, D, are less frequent causes. 124. What is the primary function of the kidneys? A. Filter blood and remove waste. B. Produce insulin. C. Store nutrients. D. Control hormone levels. Answer: A. Filter blood and remove waste. Rationale: the primary function of the kidneys is to filter blood, remove waste products, and balance fluid and electrolytes. Insulin production, B, occurs in the pancreas, and kidneys also play a role in hormone regulation, D, but their primary role is filtration. 125. What is the most common cause of chronic kidney disease? A. Diabetes. B. High blood pressure. C. Kidney stones. D. Glomerulonephritis. Answer: A. Diabetes. Rationale: diabetes is the most common cause of chronic kidney disease, followed by high blood pressure, B. Kidney stones, C, can cause acute kidney damage, and glomerulonephritis, D, is less common as a cause of chronic kidney disease. 126. What is the most common symptom of chronic kidney disease? A. Swelling in the legs and ankles. B. Severe headaches. C. Nausea and vomiting. D. Loss of appetite. Answer: A. Swelling in the legs and ankles. Rationale: Swelling in the legs and ankles is a common symptom of chronic kidney disease due to fluid retention. Nausea and vomiting, C. Severe headaches, B. And loss of appetite, D. May also occur but are less specific to kidney disease. 127. What is the most common treatment for end-stage renal disease? A. Dialysis. B. Medications. C. Kidney transplant.
D. Surgery.
Answer: A. Dialysis. Rationale: dialysis is the most common treatment for end-stage renal disease as it helps filter waste products from the blood. A kidney transplant, C. may be an option for some patients, but is not always available. Medications, B, and surgery, D, are part of the management, but do not replace dialysis. 128. Which of the following is a common risk factor for kidney stones? A. Dehydration. B. Excessive exercise. C. High-fiber diet. D. Low sodium intake. Answer: A. Dehydration. Rationale: dehydration is a major risk factor for kidney stones as it leads to concentrated urine and stone formation. Excessive exercise, B, and a high-fiber diet, C, are not typically risk factors, while low sodium intake, D, does not directly cause kidney stones. 129. What is the most common type of kidney stone? A. Calcium oxalate. B. Uric acid. C. Struvite.
D. Cysteine.
Answer: A. Calcium oxalate. Rationale: calcium oxalate stones are the most common type of kidney stone. Uric acid, B, struvite, C, and cysteine, D, are less common types. 130. What is the primary treatment for kidney stones? A. Pain management and increased fluid intake. B. Antibiotics.
C. Dialysis.
D. Surgery to remove the stones. Answer: A. Pain management and increased fluid intake. Rationale: the primary treatment for kidney stones is pain management and increasing fluid intake to help pass the stone. Antibiotics, B, are used only if there is an infection, and dialysis, C, is not typically needed for kidney stones. Surgery, D, may be required for large or obstructing stones. 131. What is the primary function of the pancreas? A. Regulate blood sugar levels. B. Produce bile. C. Filter waste. D. Control hormone levels. Answer: A. Regulate blood sugar levels. Rationale: the pancreas regulates blood sugar levels by producing insulin and glucagon. It also produces digestive enzymes, but bile, B, is produced in the liver, and waste filtering, C, occurs in the kidneys. 132. What is the most common cause of type 2 diabetes? A. Insulin resistance. B. Lack of insulin production. C. Autoimmune response. D. Genetic mutation. Answer: A. Insulin resistance. Rationale: type 2 diabetes is primarily caused by insulin resistance, where the body's cells do not respond effectively to insulin. Type 1 diabetes, B, involves a lack of insulin production due to an autoimmune response, not insulin resistance. 133. What is the most common symptom of type 2 diabetes? A. Increased thirst and urination. B. Severe fatigue. C. Weight gain. D. Nausea and vomiting. Answer: A. Increased thirst and urination. Rationale: increased thirst and urination are common symptoms of type 2 diabetes due to high blood sugar levels. Severe fatigue, B, and weight gain, C, can occur but are less specific, and nausea and vomiting, D, are not typical initial symptoms. 134. What is the most common treatment for type 2 diabetes? A. Insulin injections. B. Oral medications to increase insulin sensitivity. C. Diet and exercise. D. Kidney transplant. Answer: B. Oral medications to increase insulin sensitivity. Rationale: the most common treatment for type 2 diabetes involves oral medications like metformin to increase insulin sensitivity. Insulin injections, A, are typically used for type 1 diabetes or severe type 2 cases. Diet and exercise, C, are important but often used in conjunction with medications. 135. What is the most common cause of type 1 diabetes? A. Insulin resistance. B. autoimmune destruction of beta cells. C. Obesity. D. Genetic mutation. Answer: B. Autoimmune destruction of beta cells. Rationale: type 1 diabetes is caused by the autoimmune destruction of insulin-producing beta cells in the pancreas. Insulin resistance, A, is the cause of type 2 diabetes, and obesity, C, is not a primary cause of type 1 diabetes. 136. Which of the following is a common complication of diabetes? A. Diabetic retinopathy. B. Appendicitis. C. Gallstones. D. Stroke. Answer: A. Diabetic retinopathy. Rationale: diabetic retinopathy, which affects the eyes, is a common complication of diabetes. Appendicitis, B, gallstones, C, and stroke, D, are not specifically linked to diabetes, though diabetes can increase the risk of stroke. 137. What is the primary treatment for type 1 diabetes? A. Oral medications to increase insulin sensitivity. B. Insulin injections. C. Diet and exercise. D. Kidney transplant. Answer: B. Insulin injections. Rationale: the primary treatment for type 1 diabetes is insulin injections because the body cannot produce insulin. Oral medications, A, and diet/exercise, C, are part of managing type 2 diabetes. Kidney transplant, D, is not a primary treatment for diabetes. 138. What is the most common type of thyroid disorder? A. Hyperthyroidism. B. Hypothyroidism. C. Thyroid cancer. D. Goiter. Answer: B. Hypothyroidism. Rationale: hypothyroidism, underactive thyroid, is the most common thyroid disorder, especially in adults. Hyperthyroidism, A, thyroid cancer, C, and goiter, D, are less common. 139. What is the most common symptom of hypothyroidism? A. Fatigue. B. Weight loss. C. Heat intolerance. D. Increased heart rate. Answer: A. Fatigue. Rationale: fatigue is a common symptom of hypothyroidism due to slowed metabolism. Weight loss, B, heat intolerance, C, and increased heart rate, D, are more typical of hyperthyroidism. 140. What is the primary treatment for hypothyroidism? A. Thyroid hormone replacement. B. Surgery to remove the thyroid. C. Antithyroid medications. D. Radioactive iodine therapy. Answer: A. Thyroid hormone replacement. Rationale: the primary treatment for hypothyroidism is thyroid hormone replacement therapy, typically with levothyroxine. Surgery, B, is used for thyroid cancer or goiter. Antithyroid medications, C, are used for hyperthyroidism, and radioactive iodine therapy, D, is also for hyperthyroidism. 141. Which of the following is a common symptom of hyperthyroidism? A. Weight gain. B. Fatigue. C. Heat intolerance. D. Cold intolerance. Answer: C. Heat intolerance. Rationale: heat intolerance, weight loss, and increased heart rate are common symptoms of hyperthyroidism. Weight gain, A, and cold intolerance, D, are more common in hypothyroidism. 142. What is the primary treatment for hyperthyroidism? A. Antithyroid medications. B. Thyroid hormone replacement. C. Surgery to remove the thyroid. D. Radioactive iodine therapy. Answer: A. Antithyroid medications. Rationale: antithyroid medications like methimazole or propylthiouracil are used to reduce thyroid hormone production in hyperthyroidism. Thyroid hormone replacement, B, is for hypothyroidism. Surgery, C, and radioactive iodine therapy, D, are used in more severe cases of hyperthyroidism. 143. What is the most common cause of hyperthyroidism? A. Graves' disease. B. Hashimoto's thyroiditis. C. Thyroid cancer. D. Iodine deficiency. Answer: A. Graves' disease. Rationale: Graves' disease is the most common cause of hyperthyroidism, an autoimmune disorder that leads to overproduction of thyroid hormones. Hashimoto's thyroiditis, B, causes hypothyroidism, and iodine deficiency, D, is not as common in developed countries. 144. What is the most common cause of hypothyroidism? A. Graves' disease. B. Hashimoto's thyroiditis. C. Thyroid cancer. D. Iodine deficiency. Answer: B. Hashimoto's thyroiditis. Rationale: Hashimoto's thyroiditis, an autoimmune disease, is the most common cause of hypothyroidism. Graves' disease, A, causes hyperthyroidism and thyroid cancer. C, is not a common cause of hypothyroidism. Iodine deficiency, D, is more common in areas with low iodine levels. 145. What is the most common type of thyroid cancer? A, papillary thyroid cancer. B, follicular thyroid cancer. C, medullary thyroid cancer. D, anaplastic thyroid cancer. Answer: A, papillary thyroid cancer. Rationale: papillary thyroid cancer is the most common type of thyroid cancer, accounting for about 80% of cases. Follicular thyroid cancer, B, is also common but less frequent, and medullary, C, and anaplastic, D, thyroid cancers are rarer and more aggressive. 146. What is the primary treatment for thyroid cancer? A, chemotherapy. B, surgery to remove the thyroid. C, radiation therapy. D, hormone replacement therapy. Answer: B, surgery to remove the thyroid. Rationale: the primary treatment for thyroid cancer is surgery to remove the thyroid gland, followed by radioactive iodine therapy if needed. Chemotherapy, A, is not commonly used for thyroid cancer, and hormone replacement therapy, D, is used after surgery to replace thyroid hormones. 147. What is the most common risk factor for developing thyroid cancer? A, family history of thyroid cancer. B, iodine deficiency. C, age and gender. Women are at higher risk. D, radiation exposure. Answer: C, age and gender. Women are at higher risk. Rationale: age and gender, being female, are the most common risk factors for thyroid cancer. Family history, A, iodine deficiency, B, and radiation exposure, D, also increase risk but are less common factors. 148. What is the most common cause of erectile dysfunction in men? A, diabetes. B, heart disease. C, stress and anxiety. D, alcohol consumption. Answer: A, diabetes. Rationale: diabetes is the most common cause of erectile dysfunction, as it can damage blood vessels and nerves involved in sexual function. Heart disease, B, stress and anxiety, C, and alcohol consumption, D, can contribute but are less common causes. 149. Which of the following is a treatment option for erectile dysfunction? A, antidepressants. B, medications like sildenafil, Viagra. C, hormone replacement therapy. D, surgery to remove the prostate. Answer: B, medications like sildenafil, Viagra. Rationale: sildenafil, Viagra, is commonly used to treat erectile dysfunction by improving blood flow to the penis. Antidepressants, A, may cause sexual side effects. Hormone replacement therapy, C, is not typically used, and surgery, D, is unrelated to erectile dysfunction treatment. 150. What is the primary function of the reproductive system? A, produce hormones. B, digest food. C, filter waste. D, produce offspring. Answer: D, produce offspring. Rationale: the primary function of the reproductive system is to produce offspring. Hormone production, A, and other functions like digestion, B, and waste filtration, C, are secondary functions, but not the primary purpose of the reproductive system.